Someone asked me if I thought AI was going to replace my job in the near future. And I said, not in my lifetime. AI is really cool, and we are seeing a ton of ways to apply it in all sorts of fields, including medicine. And they are teaching robots to do things like suture. But that's not all we do in surgery. So let's take liver transplant, for example, because that is mostly what I'm doing right now. I think you could teach a robot to open skin, but then it's going to get a little more tricky. Because once you get into the abdomen, there's a lot of variability. I have never seen two abdomens that are exactly the same. Tissues are going to look a little different. Anatomy is going to look a little different. In fact, sometimes tissues are so scarred down and dense that it's difficult to actually figure out what tissue belongs to maybe the liver and what tissue belongs to the stomach. So there are times when you're literally taking things millimeter by millimeter in order to see if you can find a good plane and to just reestablish normal anatomy. And this isn't always something that can be done just by looking. Sometimes you literally have to feel the tissues. And there's a certain art to knowing when to pull and not pull, to dissect and not dissect. And the art is a little more difficult to teach compared to just the science of it. You can teach a computer, hey, you're gonna go in, you're gonna open the abdomen, you're gonna go down to the porta hepatis and dissect out the vessels. You are going to remove the liver and you're gonna place a new liver in and suture the anastomoses in this order. But how do you teach this is the exact amount of pressure that you are going to place for this patient in this situation on this tissue so that you can dissect it apart but not tear it? How do you teach this patient has weird arterial anatomy that wasn't seen on the scan? How do you teach the surgical instinct? Which is not something that everybody has. So no, I don't think AI or robots are going to take over my job. But I do think we're going to find new, creative, cool ways to incorporate robots. And that's not a bad thing.